Inflammation is one of the oldest and most essential survival mechanisms in the human body. Without it, we would not be able to fight infections, heal wounds, or protect ourselves from harmful invaders. However, inflammation can become dangerous when it shifts from acute short-term to chronic long-term. To understand why inflammation can be both healing and harmful, we need to start with what inflammation actually is. What is inflammation? Inflammation is the body's natural biological response to injury, infection, stress, and irritants. It is designed to destroy harmful microorganisms, clear out damaged cells, begin tissue repair, protect the body from further injury. Inflammation is driven by immune molecules such as cytokines, interleukins, C-reactive protein CRP, tumor necrosis factor TNF-alpha, prostaglandins, histamines. When the body senses danger, whether from bacteria, toxins, injuries, or stress, it activates these molecules to launch an immune response. Acute versus chronic inflammation. 1. Acute inflammation, good and necessary. This type of inflammation appears quickly and lasts for hours to a few days. Examples: a cut on the skin, a sprained ankle, a sore throat, a fever during an infection. Symptoms often include redness, heat, swelling, and pain. These are signs the immune system is working. 2. Chronic inflammation, silent and harmful. This is inflammation that persists for weeks, months, or even years. It becomes a low-level, ongoing immune response even when no real threat exists. Chronic inflammation is now linked to major health conditions such as heart disease, diabetes, obesity, cancer development, Alzheimer's disease, autoimmune disorders, joint degeneration, metabolic syndrome. According to the Cleveland Clinic and Harvard Medical School, chronic inflammation is considered a silent killer because it often presents with subtle symptoms that people ignore for years. Why chronic inflammation happens? There are several reasons inflammation becomes chronic. 1. Poor diet, high intake of processed foods, sugar, unhealthy fats, and refined grains increases inflammatory markers. 2. Chronic stress. Stress releases cortisol, which disrupts the immune system and triggers systemic inflammation. 3. Sedentary lifestyle. Lack of movement leads to poor circulation, weight gain, and inflammatory metabolic changes. 4. Environmental toxins, pollution, chemicals, and heavy metals trigger immune responses. 5. Poor sleep. Incomplete sleep cycles increase cytokines and disrupt hormonal balance. 6. Hidden infections. Chronic viral or bacterial infections can maintain constant immune activation. 7. Autoimmune activity. The body mistakenly attacks its own tissues, causing inflammation. The importance of early detection. Many people live with chronic inflammation for years without knowing it. This is dangerous because inflammation damages tissues slowly over time, contributing to long-term disease. Recognizing the early signs allows you to address the root causes before they escalate. Below are the 7 warning signs that your body may be in a state of chronic inflammation, backed by medical research. The 7 signs your body is inflamed. SIGN. 1. Persistent fatigue and low energy. Fatigue is one of the most common signs of chronic inflammation. Unlike normal tiredness from physical activity, inflammatory fatigue is unpredictable, persistent, not relieved by sleep, accompanied by brain fog. Why it happens during inflammation. Cytokines interfere with mitochondrial energy production. Thyroid hormone activity, cortisol, rhythm, neurotransmitter balance. Studies published in Clinical and Experimental Immunology show that inflammatory molecules like TNF-alpha and IL-6 directly cause fatigue by disrupting the brain's energy regulation systems. Other symptoms that may appear together: difficulty concentrating, slow thinking, a lack of motivation, waking up tired, even after sleeping 8 hours. If fatigue lasts longer than 2 to 3 weeks without a clear cause, inflammation may be the underlying issue. SIGN. 2. Digestive issues, bloating, gas, constipation, diarrhea. Inflammation can severely disrupt the gastrointestinal tract. Your gut is home to 70% of your immune system, so when inflammation rises, digestion is usually affected. Common digestive symptoms of inflammation: persistent bloating, gas after meals, acid reflux, irregular bowel movements, abdominal discomfort, food sensitivities. Why it happens: inflammation can cause imbalance in gut bacteria. increased intestinal permeability, leaky gut, reduced enzyme production, irritation of the stomach lining. Research from Harvard Health Publishing confirms that systemic inflammation weakens the gut barrier, allowing partially digested food and toxins to enter the bloodstream, which triggers further inflammation. This creates a vicious cycle. SIGN-3. Joint pain, stiffness, or muscle aches. Many people assume joint pain is simply due to age, but chronic inflammation is a major driver of stiff knees, aching shoulders, lower back pain, general body soreness, morning stiffness, lasting more than 30 minutes. Why it happens? Inflammatory molecules attack the joints by breaking down cartilage, reducing joint lubrication, increasing swelling, triggering immune responses in the synovial tissues. Conditions like arthritis, osteoarthritis, and fibromyalgia all have inflammation as a core component. Studies in the Journal of Rheumatology show that even mild systemic inflammation can cause measurable joint deterioration over time. SIGN-4. Skin problems, acne, rashes, eczema, redness. Your skin is one of the largest detoxification organs. When inflammation exists internally, the skin often reflects it externally. Common inflammatory skin symptoms: acne flare-ups, rosacea, red patches, eczema, itchy or dry skin. Slow wound healing. Why it happens? Inflammation disrupts hormonal balance, oil gland activity, skin barrier function, immune response to bacteria. A study from the Journal of Investigative Dermatology found that people with chronic systemic inflammation have significantly higher rates of skin disorders due to immune dysregulation. If you treat skin symptoms but ignore inflammation, improvement will be temporary. SIGN-5. Weight gain or difficulty losing weight. One of the most overlooked signs of hidden inflammation is weight resistance. Even when people eat well and exercise, inflammation can block fat loss. Why it happens? Inflammation affects metabolic hormones, including insulin, leptin, cortisol. Chronic inflammation causes insulin resistance, increased fat storage, slower metabolism, higher appetite, hormonal imbalances. The Journal of Clinical Endocrinology and Metabolism confirms that inflammatory cytokines directly impair fat cell function, causing fat cells to store more fat and release less energy. SIGN-6. Frequent infections or slow recovery. If you get sick often, or take a long time to recover from minor illnesses, inflammation is likely interfering with your immune function. Symptoms include regular colds, recurring throat irritation, slow recovery after exercise, long-lasting infections, low immune resilience. Why it happens? Chronic inflammation exhausts the immune system. Instead of responding efficiently, the immune system becomes overactive in some areas, suppressed in others. Think of it like an alarm system that is constantly ringing. Eventually, it stops working correctly. A study in Nature Reviews Immunology explains that chronic inflammation weakens immune cell communication, making the body more vulnerable to pathogens. SIGN-7. Mood changes, brain fog, and irritability. Inflammation does not just affect the body, it affects the brain. Common symptoms: anxiety, depression, irritability, difficulty focusing, forgetfulness, mental fatigue. Why it happens? Inflammation affects brain chemistry. 1. Adopt an anti-inflammatory diet. The foods you eat either fuel inflammation or fight it. Top anti-inflammatory foods: leafy greens, fatty fish rich in omega-3, berries, turmeric and ginger, olive oil, nuts and seeds, avocado, garlic and onions, beans and lentils. Foods that increase inflammation: processed meats, fried foods, sugary drinks, refined grains, excess alcohol, processed snacks, trans fats. Your diet is one of the most powerful tools to reset inflammation within days. 2. Improve gut health, because 70% of your immune system lives in your gut. Reducing inflammation must begin with digestive repair. Strategies: daily probiotics or fermented foods, prebiotic fiber from fruits and vegetables. Avoid artificial sweeteners, limit alcohol, increase water intake, reduce processed foods. Add ginger, aloe vera, and bananas. A healthy gut naturally lowers systemic inflammation. 3. Manage stress effectively. Chronic stress is one of the leading causes of inflammation. It disrupts hormones like cortisol and increases inflammatory cytokines. Effective stress reducers: deep breathing, meditation, gentle yoga, nature walks, journaling, adequate sleep. Studies show that even 5 minutes of slow breathing can reduce inflammation markers. 4. Exercise regularly. Exercise is one of the most powerful anti-inflammatory tools. Best forms of exercise: brisk walking, cycling, swimming, strength training, stretching. Just 20 to 30 minutes per day can dramatically reduce inflammatory markers like CRP. 5. Prioritize high-quality sleep. Poor sleep increases inflammation because it disrupts the body's hormonal regulation. Sleep tips: avoid screens 1 hour before bed. Keep your room cool and dark. Maintain a consistent sleep schedule. Avoid heavy meals late at night. Sleep is the body's natural anti-inflammatory repair window. 6. Reduce exposure to toxins. Chemicals in food, air, and household products elevate inflammation. How to reduce toxins: avoid smoking, drink filtered water, use natural cleaning products, minimize plastic exposure. Avoid burning scented candles with chemicals. Even small changes can lower toxic load significantly. 7. Support your body with anti-inflammatory supplements. Not mandatory, but researcher-supported supplements include omega-3 fatty acids, curcumin from turmeric, vitamin D3, ginger extract, magnesium. Probiotics: always consult a doctor before starting supplements. Inflammation is one of the most influential factors affecting long-term health. While acute inflammation protects you, chronic inflammation silently damages tissues and disrupts metabolic, hormonal, digestive, and cognitive systems. The 7 signs of inflammation: fatigue, digestive issues, joint pain, skin problems, weight resistance, recurrent infections, and mood changes are signals your body is begging for balance. The good news: chronic inflammation can be reversed through consistent lifestyle improvements, eating anti-inflammatory foods, healing the gut, managing stress, improving sleep, moving the body daily. By recognizing these signs early and taking action, you can restore your health, energy, and longevity.